We're going to go into the specifics of the vasodilators. Remember, there's three types: arterial vasodilators, venous vasodilators or venodilators, and mixed or balanced vasodilators. And they're labeled according to what side of the vasculature that they act on, the arteries or the veins or both. We're going to start with the arterial vasodilators, amlodipine and hydralazine. Amlodipine acts as a calcium channel blocker. Now, it's not used as an antiarrhythmic drug, as we talked about back in the antiarrhythmic section about calcium channel blockers. This is not one that is used for an arrhythmia, but it is used to prevent calcium from allowing constriction of the arteries. So it acts on the smooth muscle and on the calcium in not allowing that calcium to allow that smooth muscle to constrict. So we typically use this drug for cats, and cats get hypertension secondarily to chronic kidney disease, hyperthyroidism, so a disease of the thyroid gland, and diabetes mellitus. And these are three diseases that you will see in cats pretty commonly. So you will learn, if you are in a practice where you see a fair number of cats, you're going to be taking the blood pressure of these guys to look for hypertension. We typically do that with their tails. Sometimes folks will do it with a forelimb, but tail is used quite commonly for measuring blood pressure. So we'll use it to bring that blood pressure down in these particular cases. So not used so much for cardiac disease, used for the hypertension secondary to these other diseases. So hydralazine is the other arterial vasodilator that we're going to talk about. Its mode of action hasn't been completely defined. It does have to do with calcium. It's not so important that you know that, but I can't really explain exactly how it works. But anyway, it basically reduces the availability of calcium in one way or another. We use it primarily for mitral valve insufficiency. So this is our case study 3 that we're talking about. So it should be somewhat familiar to you. And also, we talked about treating mitral valve insufficiency when we talked about pimobendan. So pimobendan, if you remember, was in the positive inotrope section. So it actually does two different things. It's actually called an inodilator, pimobendan is, and it dilates blood vessels, and it also increases the contraction of the heart. So the way that hydralazine works is very similar to pimobendan in the case of mitral valve insufficiency. So the mitral valve is not closing appropriately, and we're going to dilate. So we're working on the arterial side. We're going to dilate the blood vessels so that it's easier for the heart to leave out through the aorta than back through the valve. So that is the basic idea. I'm going to forward through and just show you this picture, which I think I've shown you before, where here's an incompetent valve. We're not doing anything to the valve. We're simply making it easier for the blood to be pumped out through the aorta, then back up through the valve. So that's how hydralazine works. We could use pimobendan, we could use hydralazine, either one. Remember that sometimes these mechanisms they compensate, and so then we have to switch to a different drug. So we can use either one of these types of drugs. The drawback of both amlodipine and hydralazine is that they still allow for stimulation of the renin-angiotensin system. When the blood pressure does drop down from these vasodilators, then the renin-angiotensin system is going to respond to that decrease in blood flow through the kidneys. Okay, And we'll talk about why that is a problem as we go along through these vasodilators. So those are the arterial vasodilators. On the venous side, we typically use nitroglycerin. Nitroglycerin is a pretty interesting drug. I think it's interesting. You might have heard of nitroglycerin in association with something called TNT or trinitroglycerin, which is an explosive. We use it in a very dilute form, so there is no possibility of explosion. But what it does do is it relaxes the vascular smooth muscle on the venous side, and so blood can basically pool in that on the venous side of the capillaries, and it lowers the blood pressure overall. It's very useful. This effect works very well in reducing pulmonary edema, so the swelling in the lungs. And it's also going to lower the blood pressure on that venous side and allow less fluid to leak out of the blood vessels into the abdomen as well. So the interesting thing about this drug is that it has a very significant first pass effect. So it's not absorbed well orally. It's going to just be taken out by the liver and be ineffective if it's given orally. So we use it as a cream or a patch, and because it is absorbed well through the skin. So the cream, typically it's applied to the inner pinna of the ear. That's a place where the animal can't lick it off. If there is not good circulation, though, we may use other spots. So the axillary area, so the underarm area, in dogs and cats, or the abdomen where there isn't as much fur. We're going to put an e-collar on animals if we have to use them in those areas to keep them from licking it off. We're going to, because it's absorbed across our skin, we're going to wear gloves. We have to tell the owner to do that. This is not a good drug to send home in a household full of children, so we need to be really careful about dispensing it to families. And when it's applied, it saturates an area. So we have to switch areas or rotate between left and right ear pinna, or different axillary areas or abdominal areas, rotate our sites. And it's given every 8 to 24 hours. So it's good for owners to keep track of where they're applying it. So kind of interesting, the patch, you can cut it down to size to give the appropriate amount. Sometimes that's easier in a house with children, although some veterinarians will not prescribe these intradermal patches if there's children in a house. But you can, apply it, it sticks on, and then you can even bandage it up so that nobody touches it. So kind of a veterinary preference. So anyway, this acts to decrease in specifically pulmonary edema. Sometimes we give this as a first treatment in the hospital on the ear pinna, and then we might move to a different drug to send home. So now we're going to move to the balanced or mixed vasodilators, and we have two of them, ACE inhibitors and nitroprusside. ACE inhibitors, so this is I call it the Pril family because all of these names end in Pril. Enalapril, benazepril, captopril, lisinopril. What they do is they block angiotensin converting enzyme, otherwise known as ACE. If you remember back in the renin-angiotensin system, ACE will allow the formation of angiotensin II, which is a very potent vasoconstrictor, and then that will also allow the formation of aldosterone, or release of aldosterone from the adrenal gland. I'm not going to get into preload and afterload so much. You'll probably talk about that, or you might have talked about that in the cardiac section, but because it acts on both the veins and the arteries, it reduces the pressure coming into the heart of the blood, and then also the pressure that the heart has to push against. That's kind of the most I'm going to talk about preload and afterload. So the reason that these drugs work really well is that we think that the stimulation of the renin-angiotensin system has some profound effects in cardiac disease. We think it leads to remodeling of the heart and some other effects that we haven't really determined yet. But we found that putting animals on these drugs tends to increase the quality of life and also the length of life. So these are really desirable drugs to include in our regimen for the correct cardiac patients. The thing is that an animal has to have had the renin-angiotensin system activated in order for this drug to work, because it inhibits angiotensin converting enzyme, which doesn't exist unless that system has already been activated. So what do we use ACE inhibitors for? We'll use it for both left and right-sided heart failure because it does relieve the vasculature or dilate the vasculature on either side of the heart. So it can relieve those symptoms that I've talked about, those clinical signs that I've talked about. We also use it like pimobendan, like hydralazine for treatment of mitral valve disease. So remember, because we're dilating the blood vessels on the arterial side, we're going to increase blood ejection from the heart into the aorta rather than back through the mitral valve. So similar effect. And then cardiomyopathy. So cardiomyopathy is simply disease of the cardiac muscle tissue. It can increase in size. It can get thin and flabby. We can use it in either case to relieve the workload of the heart when the heart is not working very well. So we want to be careful, just like any vasodilators, in giving this, that we may see syncope or lethargy from an animal being given this because of low blood pressure. Captopril is particularly good at producing this sign. So we start off very low doses with captopril in particular. We want to be careful in animals that have renal disease because this is going to decrease the blood filtration through the kidneys. And so some veterinarians are very, very cautious in using ACE inhibitors with animals that have renal disease. I'm going to come back to this hyperkalemia when we talk about diuretics, because it's a very specific diuretic that we need to be careful of. So I'm going to return to that. But because ACE inhibitors will inhibit the release of aldosterone, aldosterone, if you remember, causes the retention of sodium. And so if we don't have it around and we have an animal that has low sodium or is hyponatremic, we can make an animal more hyponatremic. So we need to be cautious. Typically, cardiac patients are going to be coming in and we're going to be looking at their electrolyte levels. So our last balanced vasodilator is nitroprusside. This one, we have a very special use for it, and we use it short-term in the hospital only because it has some very specific requirements in administering it. It acts by producing nitric oxide, which inhibits smooth muscle contraction. Inhibition then allows the blood vessels to be dilated. So we use it for pulmonary edema in the hospital when an animal has severe dyspnea from that pulmonary edema. So the lungs are full of fluid, the animal can't breathe well, and we'll put them on an IV. This drug is very light sensitive. You can see it comes in an amber bottle, and so we'll administer it in a fluid line to the animal. We've got to cover that fluid line, cover a fluid bag if it's going in the fluid bag, and we have to discard any that's left over. It's really potent, so we also have to monitor it carefully when we administer it.